Mr. Sarbanes is now recognized.
Thanks very much, Madam Chair. I want to thank the witnesses for being here today. I want to acknowledge, as others have done, the powerful testimony that we heard from the first panel today. As we know, we've heard the statistic now many times today, each year more than 45,000 Americans are killed by guns, and nearly 10% of those killed are children, for whom gun violence is now the leading cause of death in the United States. Yet for nearly 25 years, until 2019, the strength of the gun lobby up here on Capitol Hill prohibited the CDC from conducting research on gun violence, effectively preventing us, the federal government, Congress, and others from treating gun violence as the public health crisis that it is. In addition to the human toll, gun violence is draining our public health system. According to GAO, gun violence costs the U.S. $1 billion per year in initial hospital costs alone. Medicaid and other public programs shoulder 60% of those costs. So we're paying for this violence. To meaningfully address the gun violence epidemic in our country, as we've been saying again and again, we must pass common sense reforms while also investing in evidence-based prevention strategies and working with communities to address the complex and systemic issues that drive gun violence. And when I say common sense, what I have in mind is many of the measures that we are going to have on the floor today as part of this legislative packet and tomorrow. Common sense to me means when you ask the average person out there in the country, including, by the way, the average law-abiding gun owner, does it make sense to do this? They say, absolutely it makes sense. They do not fear these measures because they know that overall it will create a more rational world and country for us to live in. And we've heard much about the Second Amendment. No one is here to try to upend or take away the Second Amendment rights. The First Amendment is also very important to us, and we know that there are some limitations that are placed there. We don't allow people to yell fire in a crowded theater. So as sacrosanct as these amendments are, we can put rational, common sense measures in place to achieve the right balance. Mr. Jackson, you're a gun violence survivor, as you so compellingly testified earlier, and you're an advocate for reform. Most recently, as I understand, you've been on the ground in Buffalo working to help the community recover from a horrific mass shooting that we saw there a few weeks ago. Can you describe what you've been seeing there in the weeks since the tragedy and what you know, based on your experience, is coming for that community in the weeks and months and years ahead in terms of dealing with this? And speak, if you could, to this sense of powerlessness that so many people feel when they look at Washington. This idea that please do something real that can make a difference, just something. Everyone knows this problem is too complicated to flip a switch on. You can't solve it overnight, but it's this sense of being powerless in the face of gun violence, which I think is so demoralizing to individuals, certainly to many members of Congress, and I'm sure to communities like Buffalo and others that are experiencing this pain. So if you could speak to that, I'd very much appreciate it.
Yes, thank you. You know, when I arrived to Buffalo, for folks who don't know a lot about the community, 80% of the African-American community is concentrated in one part of Buffalo. And when we got there, we saw instantly how far-reaching this trauma had impacted people throughout the community. The first vigil I went to, there was over 600 people there, torn apart. Every person you met was either a family member, a neighbor, a church member, went to school with someone, was coached by someone. Ms. Pearl Young was the first lady of her church. So you think about the generations that she touched. I met one young man who was a nephew of Hayward Patterson who had 8 children and couldn't even bring them to the funeral because he didn't want them to be re-traumatized by what had happened. And when we talk about violence and its impact, yes, 10 people were impacted and killed. Yes, we know those families, but what we don't see is the trauma that ripples through the entire community. We had people literally on their knees crying. We had folks, senior citizens and walkers, coming to memorials in tears individuals screaming at the sky in anger. And while there were hundreds of cameras, there were very little people there to help them. There were very little victim services, support services. There were very little people to provide trauma care for those who have been impacted. And what we're most concerned about now is, what does that ripple of trauma look like? We know violence is a disease, but now in Buffalo we have an entire community, and I would argue the entire Black community across the country, who have been exposed to this disease. And I think it reinforces the extent of this public health crisis and why it's so urgent that we take a comprehensive public health approach to support those who have been directly impacted, as well as those who are impacted indirectly by this trauma.
The gentleman's time has
Thank you for your
expired.